challenges that they have, the challenges of what they're going through, and the risks that they're at and the people they care for are at. I also think it's important for us as we look at this virus left unchecked would run its course like any would. The epidemiologist would show us that. But we talked about the very first time I spoke to you on COVID-19 was that doesn't mean that we have to allow it to direct where it ends up. The actions that we're taking can shift that away. And today we want to take the time to detail the plan that we've been working, looking at, implementing, and now ready to go full force on is a battle plan about dealing with these long-term care facilities, reducing the death, reducing the infections, and tackling this. This has been going on through all these weeks, but right now, and I think one of the things is we're prepared to very much go on the offensive, and that is no small part because what all of you have done. You have provided the important PPE. You have provided the time necessary. You have provided the resources and the time to create the testing that will be a part of this strategy, and now bringing all of those things to bear to reduce these numbers. So Commissioner Malcolm is going to spend some time today, the bulk of today, talking about this, but it's a plan pretty much predicated on the best practices, and while it seems very obvious, much of it was dependent on things that we did not have 30 days ago, and we do have today. Expanded testing for residents and workers in long-term care. Testing is one part of it. You can test somebody in the morning, and they could end up positive in the afternoon. But what testing allows you to do is have a site picture and be able to trace and isolate and make sure that they did not spread to others. Provide support and troubleshooting to clear any barriers. Personal protective equipment to facilities needed. The state is going to stock up our strategic state reserve to a point where we're able to get them out there. And I think about this, those out there working just like my mother did for all those decades, there are nurses working in many different places. There are care assistants working in many different places. And for many of these facilities, the use of PPE, N95, gloves and things was not the norm 30 days ago. And so there was no need for these folks to, they were not stocked up on it. Now, as they're trying to battle with everyone else to get the equipment, we're going to bring the weight of Commissioner Roberts Davis, her team with Joe, that have been able to bring this PPE. We're going to ensure adequate staffing levels from the hardest hit areas, and she'll talk about that. We will make sure we have the folks in there, because this can be a crisis situation where if staff are not able to get back in, these folks need to be cared for on all kinds of levels of issues, from daily care to the underlying health issues, not to mention a quality of life issue. We do not warehouse our seniors and not interact and provide things for them. That's what the staff is doing. And leveraging our partnerships for these facilities are better to apply skills and talent. So Jan will in just a moment walk through some of that. Before she does that, I want to mention a little bit, big weekend, it's Mother's Day on Sunday, and of course, fishing opener. Walleye, lake trout, pike, bass. This is something that literally hundreds of thousands of Minnesotans every year look forward to. There's good news in this, that for the first time in 20 years, fishing licenses have reached back to a plateau where they were in the year 2000. You hear me every year talking about the decline in this. While there won't be an official governor's fishing opener, which for me is a good thing because Lieutenant Governor Flanagan outfishes me and I won't have that indignity this time, folks are going to be out fishing. But I want to be very clear. We want folks to enjoy the outdoors. We want folks to be able to get what we keep showing on the slides, the well-being and the quality of life that goes with this, but it is imperative for others, and it is imperative for these long-term care facilities. It is imperative to not overload our system, that people do it smartly. That means social distancing. It means staying close to home. And our rural communities and our tribal leaders, there have been many of them express concerns about this. There's a bit of a catch-22 here where we have resorts and folks that want to get back to normal, but we also have folks in leadership positions that know you can't overwhelm smaller communities, and certainly at some of our more risk communities because of age and underlying conditions, and our tribal communities being one of those. They have asked very graciously that we get that message out, all folks across greater Minnesota. So I would ask all of you, think about this for others. There's a lot of ethics that goes into hunting and fishing, and those who take part in this as a tradition. No, it's a part of who we are. And one of the ethics is how you treat others on the lake, how you treat others in the field, the courtesies that go with that. It's a little different this year because added to that is the courtesy of not overloading lakes somewhere away from you, not putting people at risk who simply live there in communities that can't take it. So I would ask you to think about that this week. I would ask you good luck and enjoy your time fishing, but do it close to home. Do it with social distancing. Do it with family. Get your kids out there. Teach someone to fish, and enjoy what Minnesota has to offer, but let's not put each other at risk. And then this week we were honoring different groups of folks. We honored Teacher Appreciation Week and Child Care Provider Week. And yesterday we highlighted, as again, it's on everybody's mind, highlighting our nurses. We can't say thank you enough. It almost seems hollow just to say thank you when you see the folks coming out of a shift change, but those thank yous have turned into large gatherings of clapping for people being there for them. It's turned into people providing meals for these care providers or providing lodging when they needed it. And yesterday, our own Minnesota National Guard participated in a flyover to honor them. Many of their own are out there serving on the front lines and have been for many years. Now they're in the COVID-19 fight. So I want to say a thank you to the nurses. Thank you to those members of the Minnesota National Guard who did the salute. And again, thank you to Minnesotans. The surest way, if you want to thank a nurse, is wear a mask, social distance, try and if you can work from home, and think about your neighbors. Those are the ways you thank a nurse. Those are a way we don't overload the system. And with that, I would like to turn to Commissioner Malcolm to spend a little bit of time talking about how we're going to lean into this and turn this the situation in long-term care into a positive. So thank you.
Thank you, Governor, very much for that really excellent reminder of what we all need to be thinking about this weekend as we celebrate some of the best of Minnesota. So I'm going to start with the regular situation update and then spend some time on this battle plan to protect long-term care and the residents and workers therein. The global and national update as of early this morning was more than 3.76 million cases and 264,000 deaths all around the globe. We keep saying these numbers and sometimes we can get almost numb to them, but those are truly staggering statistics since the beginning of this year. In the United States, as of this morning, we were over 1.23 million cases and 73,400 deaths. And as the governor has mentioned, here in Minnesota, we added another 780 laboratory-confirmed cases from yesterday. Notably, a third of these cases were from the counties of Stearns and Noble, where we continue to work hard to help those communities understand the spread of disease. And we will be wanting to keep a close eye on how those numbers change as the plants are working hard to contain outbreaks and as the JBS plant reopens in Worthington. So this is another significant jump in cases. As we've been suggesting, we need to be prepared for these kinds of numbers going forward. We are still building toward the peak. I know it feels like we're hoping that we're getting back into some rhythm of normal, but indeed we are on that steep part of the curve, and we're going to just expect to see more and more cases each day. As we test more, we will find more. We've been saying that over and over again. I'm glad, though, to say that we're still seeing an 8-day doubling time in the numbers of cases. So the number of cases is one thing. That doubling rate helps us, again, keep a sharp eye on hospital capacity to know when we need to potentially trigger those expansions of ICU capacity that the hospitals have planned for, along with the alternative community care sites that the State Emergency Operations Center will stand up if needed. So that hospital case doubling time is a critical metric for us to keep an eye on, and we still are at 8 days where we've been since last Sunday. Now that is shorter than what had been the case the week prior and the 2 weeks prior, so we expect to see it shorten, but we're keeping an eye on how quickly that happens. And as the governor said, we've passed an unfortunate milestone with 508 deaths now in Minnesota, an additional 23 from yesterday. This set of 23 includes 17 in Hennepin County, 3 in Anoka, 1 each in Clay, Ramsey, and Stearns. So as I think we mentioned a couple of days ago, we're down to only a couple of counties in Minnesota that have yet to confirm a case. We are quite certain there are cases in all counties, but do not yet have laboratory confirmation in a couple of counties. Demographically, we have in today's totals, unfortunately, 7 people in their 90s, 4 in their 80s, 6 in their 70s, 2 in their 60s, 3 in their 50s, and 1 person in their 40s, with no details as of this point as to whether this younger person had underlying conditions or not. As I think I mentioned a day or two ago, it does occasionally happen that a young, healthy person with no evident underlying conditions can be taken down by this virus as well. This virus has many unpredictable twists and turns to it. There are today 435 patients currently in the hospital, 182 of those in intensive care. Again, we're happy, relatively speaking, that the intensive care numbers have continued to grow at a fairly measured pace, giving us, again, time to work with our hospital systems, our health systems, to expand that capacity as we see the need for that coming. I want to make a quick note, and we're going to talk more about this in coming days. We've mentioned that we know that the burden of this disease falls differentially on different parts of our population. I think I've mentioned before that for Black Minnesotans, they have their case rates are twice their proportion of the population as a whole, and 3 times the rate of hospitalizations, as is true for the white population. So clearly, we've got now, with the data growing, we can quantify the degree to which the exposures and the significance of the exposures are different. And again, we'll be talking more about this in days to come. I'm going to shift now into talking about the enhanced focus, the increased focus on long-term care settings. And the governor refers to this as our 5-point battle plan. And I think battle plan for a good reason, because one of the things we're going to be doing is more intentionally and proactively engaging the skills of the State Emergency Operations Center to help us scale up the logistics that heretofore really has been a health department effort kind of on our own, and that's changing. And as we've been saying all along, that we've known since the beginning that long-term care facilities, the people in them, the workers and the residents, face an elevated risk for outbreaks and severe disease, both by simple virtue of the demographics, the age, and the underlying health conditions of people in these facilities, and the fact that they're in congregate settings, and the fact that, as we've talked about many a time, the long-term care industry has suffered for a long time with staffing challenges. It's, as the governor shared his mom's personal story, it's difficult work. It's not well-paid work. And it's been challenging for the long-term care providers to attract and retain this kind of skilled staff in the numbers that are needed. And so I've said, I think before, that this pandemic, as is true in many other respects, is shining a brighter light on some systemic issues that have been there for a long time and really exacerbating some of the challenges in the industry. Now, we know that residents of long-term care facilities account for a little under 1% of Minnesota's population. However, they account for 15% of Minnesota's COVID-19 cases, 23% of the hospitalizations, and very, very startlingly, 80% of the COVID-19 deaths that we've seen in our state. Of the 23 deaths that we announced added to today, 17 of them, once again, were in long-term care residents. And we've talked, and we can talk more in the Q&A, about how these numbers compare to other states. That we do have a high reported rate. And I've mentioned, I think, in the last couple days' press calls, we believe part of the reason for our high reported rate is that we are being very inclusive in what we're counting in long-term care and congregate care. And given that the federal government only requires reporting to the CDC of skilled nursing facilities, we believe that that is a part of the answer to why we're reporting larger numbers, because we're casting a broader net, and we think that's appropriate. It's this larger set of congregate care settings that present this same risk. So for us, it's important to count more than just skilled nursing facilities, assisted living, group homes, mental health and substance abuse centers, adult foster care. All of those settings for us are part of this. What we're talking about today is really focused on the elder care, long-term care facilities, nursing homes, and assisted living, but parallel conversations are going on around how we can also beef up support for group homes and other settings. And certainly the prison population we've talked about and can talk about more in future days as well. Some of these same principles will apply in those settings as well. But I think it's also important to put this in a little bit of context. COVID-19 is not hitting all long-term care facilities equally. It's 1 in 5 of our skilled nursing facilities that have cases, that have at least laboratory confirmed cases. And it's a little more than 1 in 10 assisted living facilities that have cases. Most of the facilities that have cases have only 1 or 2. So there are 330 total long-term care facilities, again with this expanded definition of who we count as long-term care. 330 facilities have confirmed cases. 141 of them have 1 case. 46 have 2. 143 have more than 2. 88 of these facilities have only cases among residents. 102 have cases only among healthcare workers. 121 have cases of both residents and healthcare workers. I want to make just an additional note about healthcare workers. I mentioned previously that we're starting to be able to dig deeper into the data to see how racial and ethnic inequities show up in COVID as well. Well, we know about the healthcare workforce, and I think, again, you'll hear more about this in coming days, that as a percentage of Minnesota's total workforce, the white population is 80% of the workforce, and the black population is 6% of the workforce. And these are just as examples. And Hispanic populations are 5% of the workforce. However, in the congregate care workforce, the congregate care workforce is 74% white, 19% black, and 5% Hispanic. Among those tested positive, 38% are white, 43% are black, and 6% are Hispanic. So we know that this congregate care workforce has many members of, for instance, of the African immigrant community. They have been a critical part of the workforce and are a critical part of the workforce in these facilities. And we can see with this data that they are being quite disproportionately affected as well. So the strategies that we're talking about here are certainly to protect residents, but also the workers in these facilities who we know face risk and are doing, and have always done, incredibly important work, but never more so now than when they know that they are dealing with people at elevated risk. And as the governor has said, and I've said many times over these last weeks, we've been focused on this population and working with these facilities since the beginning of the epidemic. We've, since the beginning, done weekly briefing calls with leaders from the industry. We've pushed out tons and tons of guidance about infection control, about protecting workers, protecting residents. We've, since early days, implemented a plan where when there's 1 case in a facility, a response team is convened to connect with that facility to help them with enhanced infection protection and the like. And each facility with an outbreak has been assigned a case manager from the state health department to check in with them daily. And critical situations since the beginning have always gotten extra help to try to address immediate crises and to plan next steps. So we've been in what I would call a reactive mode since the beginning. And I think I've showed you data on an earlier day about how when we first saw the first confirmed cases in long-term care, which was in late March, we immediately began testing more in long-term care and finding more. So we've had an enhanced testing strategy, but it's been around only testing symptomatic patients and their immediate contacts. That's been where we've been for the last number of weeks. So what we're doing now is really trying, as the governor said, to harvest the lessons of the last 7 weeks, to figure out what's been working and what hasn't, and to strengthen the plan to better support and protect residents and staff. And the goals that we have certainly are to continue to preserve, first of all, of course, most importantly, to make sure that we're reducing infections among staff and residents. But also, this is a critical part of the strategy to preserve hospital capacity as well, by ensuring that facilities can keep residents, can care for them safely and appropriately, who don't need to be transferred to the hospital. We also want to more quickly identify facilities who need additional support and help all facilities plan for and manage COVID-19 infections. We're glad and impressed that so many facilities have not had cases yet, but given the trajectory of this epidemic, we have to do more, and we have to work with every facility, whether they have cases or not, to make sure that they are ready for the very real possibility that they will have cases. So what we are going to be doing is providing additional support for facilities to keep their staffing levels up, to ensure that they can get the personal protective equipment they need, to better train their workers on resident care and infection prevention, and building and maintaining enough bed capacity for residents with COVID-19 who don't need to be in the hospital, whether that is supporting facilities to have special wings or floors for COVID care, the COVID support sites that we've talked about, and potentially the use of alternative care facilities for long-term care residents that are sort of in parallel to the alternative care sites that you've heard about from the acute care side. So the 5 points of our plan, and I'll try to be clear about what's different than what we've already been doing, is to expand testing for residents and workers in long-term care facilities. I'm going to go through each of these points in a little more detail, but just to repeat the 5, which the governor already outlined. Expanding testing for residents and workers, providing testing support and troubleshooting to make sure that the tests happen faster, to get personal protective equipment to the facilities when they need it, to ensure adequate staffing levels for even those in crisis, and to leverage our partnerships to better apply their skills and talents so this isn't just MDH. This is truly a statewide plan and a statewide response. So in terms of expanding testing, we are issuing new guidance on testing, screening, and monitoring with requirements for long-term care facilities to do a few things. Number 1, institute consistent active screening practices for all residents and staff, checking health indicators several times a day for residents and staff, including the use of pulse oximetry for residents, which is turning out clinically to be a very important and valuable early warning sign as somebody's oxygen levels start to drop before they have additional COVID-like symptoms. Expanding testing to all symptomatic residents and staff, as well as, and this is a big change for us, a plan for facility-wide testing when a case is confirmed or when multiple people develop symptoms. So instead of just testing the symptomatic and their direct contacts, we are now will be instituting a plan to screen everyone in a facility when there is a confirmed case or multiple people with symptoms. And then we will continue routine testing of residents and staff meeting specific risk criteria. We know that testing is not a one and done event. As the governor said, you can test negative one day and positive the next. One of the things we're working with CDC on is figuring out the right kind of retesting schedule based on a study that we're doing right now. So more detail to come on that, how often this testing regimen will need to be repeated, because it won't be just one time. Amplifying, expanding, and accelerating work on facilities' action plans for COVID-19 cases among residents or staff, including steps for dealing with many cases. So asking every facility to have a plan for what they will do when there's one case, a couple cases, and what they would do if they have many cases. Many of the plans aren't looking far enough ahead in that regard. And continuing to ensure that staff are trained on proper use of masks and other protective equipment. One of the things we've found is even when folks are using equipment, they may not be using it correctly to provide all the protection that is needed. On the second point, providing testing support and troubleshooting. And here's where the system that the governor announced a couple of weeks ago comes into play. Now that we've got the testing command center and all of the health systems working together to coordinate testing, we'll be working with the health systems to create strike teams that can quickly go on site to do the testing, the facility-wide testing, and the necessary follow-ups, including helping us, from a public health standpoint, initiate that contact tracing immediately. We'll be doing more coordination with the 8 regional healthcare coalitions around the state so that they are on the front lines of helping us to mount these strike teams. And again, coordinating with the Testing Command Center to move the supplies around where they are needed. The third point, getting facilities needed protective equipment. We so appreciate Commissioner Roberts Davis's team, who have taken on an expanded role since they first started to get going, when the focus was really on acute care, realizing the critical importance of protective equipment for long-term care to further build up our state-managed cache of masks and other equipment for these long-term care facilities when they exhaust their own supplies and are unable to restock through their normal supply channels, and to be proactively pushing out needed equipment for facilities facing outbreaks and to make it available to other facilities based on availability, so that we're pre-positioning as much as we can. The next point, and this is really a vexing one, to ensure adequate staffing levels. We've been working really hard to try to support facilities when they hit crisis, when all of their workers or a great majority of their workers are out sick, or when they have staff who are afraid to come to work, who walk off the job because of their fear. And we've done that on several occasions, literally scrambled to get staff in there to cover an overnight shift when we see it coming. But we need to do more than that. We need to figure out a more sustainable long-term strategy for how we're going to get staffing support into these facilities when we see this crisis coming. And this will include things like tapping of funds made available by the legislature, like the COVID-19 fund, tapping that fund to build what I think Connecticut has used. We're learning from our peers around the country to support bridge staffing teams of healthcare workers to provide temporary staffing for a couple of days or a week if needed. So not just covering an overnight shift, but looking more broadly at what the staffing need is going to be. We do need the support of the federal government, as well as the support we've had and will need more of from the state legislature to address long-term care staffing crises. We will be making greater use of the Minnesota National Guard where that is indicated, and it's one of the key reasons why we're grateful to the State Emergency Operations Center and Joe's staff to take on much more of a leadership role and much more of a proactive role in looking ahead at where and how we can best deploy the Guard. Using databases to match healthcare workers and available other volunteers to where we need to fill shifts, and using incentives to encourage health systems and workers within health systems to be willing to provide crisis staffing to long-term care facilities. So a lot of work to be done to build out that staffing strategy, but we do know there are a number of tools in the toolbox that we can use. And the fifth point, leveraging our partnerships. As I've mentioned, heretofore, this has really been an MDH show. The State Department of Health has been kind of trying and working really hard to manage these growing needs across the state. And we've been doing a decent job, but we don't think we don't just think, we know we don't have the resources to be everywhere as much as we need to be with the growth of this epidemic. So we are working with our local public health partners to put them in more of a frontline leadership role in dealing with the facilities in their region and supporting them and training them to provide greater on-site technical assistance to the facilities who are their neighbors. Launching a new case management model at facilities so that it's not a central MDH person who's remote, but someone nearer to them, leveraging local public health and the regional coalitions to provide that support. And making sure that facilities also maintain strong preparedness plans, including plans to reduce transmission and limit exposure risks. Like I said, not just hoping that they can avoid cases, but assuming they're going to have cases and planning for how they'll react differently at higher levels of cases, and continuing to require facilities to commit to reducing transmission by excluding ill workers and those testing positive, and by excluding workers with unprotected exposure. So long-term care facilities themselves certainly are critical partners here. How will we measure success here? Well, we will consider it a big success if we can keep the numbers of positive cases low after an outbreak begins. Just the reality of the progression of this epidemic around our state probably means that many, many more facilities are going to see cases, but we want to keep it in the 1, 2, 3 range and not see so many facilities with 10, 20, and more cases. And to reduce the proportion of positive tests in long-term care, even as we start testing more and more people, to see the proportion of those positive cases go down over time. To provide on-site infection prevention support to every facility with even one case, and to make sure that all facilities have updated preparedness plans and are able to access staffing support without unnecessarily transferring residents to other sites for care, and to make sure that we can get regulatory infection control citations down below pre-pandemic levels. This is a focused and detailed plan. Now it needs to be operationalized. And this is truly a statewide commitment, well beyond what the State Department of Health can do on its own. We really need these partnerships with our healthcare system partners, with our local public health partners, the long-term care industry itself, and our friends at the State Emergency Operations Center to apply their logistical expertise to helping us scale up to now the full dimensions that we see will be needed across the state. There is much good work happening in long-term care facilities. I really appreciate the way the governor started us out today. There's a lot of good work going on in long-term care facilities, people working really hard who have strong mission commitments to taking care of our loved ones. And we have been providing them a lot of support, but it's not been enough. This is not so much about fixing something that's broken or deficient as it is about ramping up our systems to deal with an unprecedented level of need. We want to spread and accelerate the best practices that we know are out there and give the facilities all the support they need to rise to this unprecedented challenge. With that, Governor, I'll turn it back to you for questions.
I will keep you close. I'm sure you're going to be asking a lot. Well, thank you, Commissioner. And we wanted to take the time to detail this because I think so many have focused on this. And again, I told the story of my mother. Now she's on the other end of it. She's 85 and thinking about the care that she's getting and how that works. I think that's the story that most of you have out there. And I think Jan summed this up right, that it was the work that was being done and the traditional ways to fight these things were being done. COVID-19 is very different. Now that we have the resources, we have the knowledge, we're taking this fight to it in a way that the expectations are, and I think anything we do is how are you going to measure it, how are you going to measure you got there. We need to do that because when it comes down to it, they aren't numbers, they're people, and their quality of life issues throughout those whole facilities. And I think coupled with a renewed emphasis on testing and tracing, an emphasis on smartly reopening our economy by turning that dial in a smart way and getting buy-in from Minnesotans, and then taking the fight where we're seeing the most infections and the most fatalities is a way that we get this thing into a position where we can manage it over a longer term. That's always been our goal, to get to a stability in society where we're able to open up as much as we can, reduce deaths to the lowest level we possibly can, and be ready to respond as this thing comes back in the waves that it comes. So I think I want to thank the folks across state agencies, thank Commissioner Malcolm for the lead on this. These are things we're sharing with other states because, as I said, again, this is the number one thing right now, along with testing and PPE issues, is this pattern is holding true everywhere else across the country. With that, Mary, start us out.
Governor, this is a question we've talked about a lot over the last couple of weeks and months. What about the workers within the facilities? I have a question from within a facility saying, what happens if they get 10 to 30% positives and they start losing a third of their workforce?
Yeah,
how do they keep going?
Yeah, and I'm going to have Jan answer this. There was one of the things early on this when people were trying to figure this out. There was a fear if we tested workers, we would find them positive. They would have to leave immediately. Who's there the rest of the day? And this situation came up. So, Jen, I'm going to have you tackle this. It's a great question because it is going to happen.
Yeah.
And that's really why I think we're turning to the SEOC and its logistical acumen to mobilize large efforts quickly in a crisis situation. When you guys have asked this question multiple times, we've got a lot of state workers furloughed, a lot of people in the economy not working right now, a lot of people willing to volunteer their time, a lot of healthcare workers. So how do we mobilize them? How do we organize all that and create the logistics to be able to?
They have large job openings. I'm sure you've heard this on the conference call.
Yes.
We've heard there are hundreds and hundreds of jobs right now before widespread COVID hitting the employee base, and they can't fill those jobs.
Right, and partly it is the things we've talked about, the low pay, the difficult work now, some elevated concern about the safety of the work, the importance of having the equipment and having the right protocols in the facilities that they can trust, that there's good infection control and good management of the COVID positive patients. So I think that the goal is to anticipate more of those situations where it's not just covering a shift, it's really being able to mobilize a much larger workforce to be able to go where needed to cover these situations.
Could that come from the state workforce? Could you start to mobilize some furloughed workers?
Yes, I mean that's one of the things that we're going to look at is how do we mobilize people that are ready and willing to work? How do we get more volunteers? One of my peers in another state has done a big recruitment campaign for students who are in higher ed going into health careers to volunteer to be part of this surge workforce. So, but again, just the logistical acumen that it takes to put all that together is where we're really going to be turning to the SEOC.
A couple of quick questions about specifics in your presentation. First of all, as far as this increase of testing, if there's a positive case or multiple people are showing symptoms, when does that start? Tomorrow or sometime in the future?
Well, we've been doing it through the testing command center on a couple of occasions already in the last couple of weeks, and we've had health systems like Hennepin Healthcare, who has stepped in and done this very kind of thing with a number of the long-term care facilities in Hennepin County. So we've already had some instances where this is already happening and happening quickly. We want to scale it up so that it isn't just a matter of is there a willing health system down the street that's got the capacity, but say there isn't. The testing command center needs to be able to deploy the testing resources into there to get the samples and do the tests. So that will, as I mentioned, I think the governor did too. All of this isn't going to be in place tomorrow, but the goals are clear, the strategies are clear. Now we need to operationalize, and certainly with the testing capacity that we have now, and is growing every day, we've got the logistics. Now we just sort of need to put that machinery to work to be able to do that predictably and routinely everywhere.
And then you mentioned more funding was needed from both the state and the feds for adequate staffing. How much do you think is necessary?
Well, I don't have a number for you right now. I mean, as we mentioned, this has been a chronic problem. I know there are discussions right now about pay incentives, retention incentives, hazard pay ideas. All of those things need to be under consideration. We do have, when it comes to these strike teams, and there we might be talking about taking health care workers who are furloughed or otherwise not occupied, and bringing them in to support the long-term care facilities. And some of this funding we think can come from the existing COVID-19 fund. But as we say on so many of these topics, really to do this at scale and to deal with the legitimate needs around the whole state is going to take federal resources as well as state.
Can I ask, you had mentioned during your
Can
presentation.
I follow up on one with this? We'll make sure we give you plenty of time today, because Theo brought up a great point in this testing one. It was 2 weeks ago today when you asked, okay, you've got this new capacity, when are you hitting 5,000? And I said May 5th. We hit 4,200 is all today. One of the issues we're finding with testing, just because you have the capacity now and you want to do it, doesn't mean that the folks are coming and getting it. And this is the conversation that Commissioner Malcolm and I had this morning, exactly the question you asked. So if you have this extra capacity, are you going to drop in there with this team, get these done and get results? And so that is part of it, I think, to follow up on how we're viewing testing and how we use it, because we're learning more about it. And the epidemiologists will tell us it doesn't necessarily make sense to say you're going to be any safer if you test everybody. They could be infected in the afternoon when the shift came in the afternoon. You have to use testing smartly, but that type of capacity can go a long ways. And then I want to go back to this issue on staffing. It has become clear in our society, and is one of the issues. I went out and last year walk today in the shoes of a personal care attendant. With those folks are out there right now caring for people with MS and other things in their homes, and then it's not congregate care. And I talked about the areas where we see this. We saw it in folks working at nursing homes, personal care assistants, and now like grocery store clerks and things. Folks that we pay the least amount of money have been on the front lines of this and the hardest thing to do. So it shouldn't surprise us now when this is super dangerous, doesn't pay people a lot of money, that they're nervous about it. So I do think it's going to take us figuring this out. The good news is I think right now as we speak, the legislature is talking about what they can do on the COVID-19 fund. So it's a great question. It's one, this one keeps us up at night, and that's what we're looking at, that state workforce, National Guard, others.
Just for the commissioner, perhaps, you'd said in your presentation you've had 7 weeks to figure out what's worked and what hasn't worked. So what has been ineffective in your efforts to prevent this spread and the deaths in the long-term care facilities? What hasn't worked?
Well, I think I perhaps didn't state that very well. I think what we haven't fully anticipated is the number of facilities that would need help. You know, that it wouldn't be just 1 or 2 outbreaks happening at a time, but that we really needed to get ready for much larger scale efforts. Our kind of traditional swoop the experts in and have it be very centered on state health department expertise to do all the investigating and all the coaching of infection control just is not adequate to the task of being able to get out there quickly enough and to be thinking far out ahead enough. You know, I all the time, Governor and I talk regularly about, you know, in hindsight, what would we have done differently? You know, I would have seen this coming, you know, more at the scale that it's coming earlier. It has taken us by surprise how many facilities will need kind of this level of enhanced help at the same time. Again, though, I just want to reinforce, we're still talking about, you know, 1 in 5 skilled nursing facilities and just a little more than 1 in 10 assisted living facilities. But rather than hoping what we can contain it here, we have to be ready for it to continue to spread. And that's, I think, where we just need to get less reactive and more proactive about assuming that this is going to continue to be a challenge.
As a follow-up on the strategy, I mean, a huge number of these residents have things like dementia or conditions that require some sensitivity. Can you just plug a National Guardsman in to provide the level of care and supervision that they're going to need, or are you going to have to do some training of these people that you're going to put in?
No, it's a very good question, and certainly, you know, we think there are a lot of things the Guard can help us do logistically, getting supplies to places, getting, you know, and there are certainly trained people in the Guard that have some of the clinical skills needed. But yes, we are going to need to be doing a lot of training of the workforce to be able to provide the sensitive care that these folks need. And it's a big part of the reason why we continue to say that it is a goal to help give these facilities the support they need to keep people safely in their homes to receive the care that they need from the staff who know them and who know how to care for them.
Governor, Greater Minnesota Press, many questions about the coming weekend and travel. I'm getting questions from 2 directions. Can Minnesotans leave the border and go to other states for cabins, for recreation? And can people from Wisconsin, Iowa, South Dakota, North Dakota come into Minnesota for fishing opener?
Well, we're discouraging people from doing that. Our guidance is to not do that, to stay close to home, to not leave the borders. We're not setting up roadblocks at the South Dakota border or North Dakota border or Wisconsin. But the fact is that we know that the more people travel, the more the spread is, the more that we lose containment of that. So we've been pretty clear on the guidance. Stay close to home, fill up with gas at home. Don't stop and use a lot of the things you would normally do if you're going to go fish. So we're going to discourage folks from doing that. Usually, you know, we've got DNR folks out there, you know, checking licenses, making sure people have their life vests on, staying safe. But again, I want to come back to this. This is not about defying an order that I put out. This is about defying public health warnings. This is about defying the science of how this stuff spreads. So I would just ask people what Minnesotans have done a really good job of. And I understand the frustrations on all of the what you can't do and all that, but I think there's an added frustration for being pretty good on this on the front end. We'll see more as we're looking at this, but we may be one of the last states to peak when we're doing this, but we're going to peak. And I said, what is most distressing to me, even if we continue to keep that 8 days on cases, 8 of the last 9 days, we've averaged 24 deaths. So I know when I'm standing in front of you on May 27th, even if we do a fantastic job, I'm going to be talking about the 1,000th death. And so what I'm asking people on this is stay close to home, use common sense, fish in a new place, don't travel across state lines if you don't. I know it gets a little tough when the nearest lake might be right across in Wisconsin rather than coming over. We certainly are asking people to use common sense around this, decency towards others.
Can I follow up? You said we might be one of the last states to peak. Would that
We've
be
been
a
watching Governor
victory, or is
Tim
that
Walz's briefing this afternoon about the state's response to COVID-19. We heard Governor Walz and Commissioner Jan Malcolm lay out a 5-point battle plan for how they plan to address COVID-19 in long-term care facilities, including things like supporting testing, getting PPE to those facilities, and also helping them staff. We'll continue to track developments this afternoon and bring you updates as they happen on the WDIO website, our mobile app, and tonight starting at 5 o'clock on WDIO News. Have a good afternoon.
This has been a WDIO News Special Report.